right, let's get started. Hello, everybody. Thank you so much for joining. Today, we're going to be discussing how we collaborate with local nursing schools to hire and retain nurses. And we have a phenomenal speaker with us. My name is Iman Abu Zaid. I'm an MD by background and CEO and co-founder of Incredible Health, which is a career marketplace for hiring permanent healthcare workers, including nurses. Incredible Health is the only platform that allows hospitals to hire permanent experienced nurses in 20 days or less by flipping the script. Hospitals and health systems apply to the nurses instead of the other way around. Joining us today is Margot Rios. She is Chief Nursing Officer at CHRISTUS Spohn Hospital Alice. Her hospital is a regional hospital that serves Alice, Texas, which is about 2 hours south of San Antonio. Margot has been at Alice Hospital for her entire career, right, since the 1970s. She's also partnered with local colleges and high school programs to provide opportunities for students to experience the many different roles of being a healthcare worker. Welcome, Margot.
Thank you. Happy to be here today.
Thank you so much for joining us. So for those in the audience, this is designed to be interactive. The chat is open, and you can also submit questions. We have time dedicated at the end to answer as many of the questions as we can. And then please, but you can submit them throughout the entire time. Also, this webinar is recorded, so a member of our team at Incredible Health will be reaching out to you afterwards to share the recording as well. All right, so today we're going to be covering a few different topics. We're going to be covering, do an overview of the nurse labor market today. We're going to cover the nurse hiring strategies, how to collaborate with local schools to drive your hiring, nurse retention, and how Incredible Health can help. And then, as I mentioned, there will be time at the end for Q&A. All right, let's do a really quick market overview just to set the scene so everybody's on the same page. So we're, Margaret and I were just chatting earlier about it's quite a challenging time to be working in healthcare. Healthcare is the biggest labor sector in the country by number of workers, and it's also, but it's also the sector that has the biggest labor shortages too. In 2018, healthcare became the biggest labor sector in the country. However, our demand for healthcare as a country keeps increasing because our population is aging, and we haven't done, as all of us collectively as a country have not done most to increase the number of healthcare workers to meet that demand. And so many of us are experiencing pretty significant shortages in labor. And so the consequences of this are a few. First, we are on track to be 1.1 million nurses short by the end of next year. The annual turnover is increasing. It's the national average right now is almost 20%. The labor costs are also going up. So labor as a percentage of revenue is at 48%. That is an increase over the last few years. And it's not just the temporary or premium labor costs, but even the cost of permanent labor has increased as their wages have increased. And then also the time to hire a permanent and experienced and specialized nurse, is also increasing. The average right now is 89 days to fill a permanent and specialized nurse role. All right, so one next piece of data I wanted to share before we dive into the deeper topics here is what are some of the top reasons why nurses are leaving their jobs? When nurses are signing up on Incredible Health, and we have about 10% of US nurses in the country using our platform, so hundreds of thousands of nurses, we often ask, what is it that you're looking for? Why are you leaving your current job? By far, the number one reason is they're looking for career advancement. The second most common reason is they're looking for a more flexible schedule. Third is something to do with geography. They're either relocating or they're trying to reduce their commute time. And then the fourth is compensation, looking for higher compensation. It is in this order. So by far, a large percentage of nurses are looking for career advancement, which includes things like growing their skills, cross-training, looking to specialize more, moving into leadership, and so on. All right, so Margot, welcome again.
Thank you.
I'm just going to put the slides down while we do our Q&A. So you've been a nurse for a long time, a nursing leader for a long time as well. Would you mind just sharing a bit more about how the nurse workforce like environment has changed just over the last couple of years at your hospital?
One of the things that we have seen in our community is that individuals we hire that tend to stay at our facility, and we retain those individuals if they have a family member in the community, if they're caring for family, if they grew up in the area. So that's been one of the most successful recruitment avenues for us. We are a rural community, 2 hours away from San Antonio, an hour away from Corpus Christi, and about 2.5 to 3 hours away from the Brownsville, McAllen area. We feel that you're right when you take a look at the numbers related to the shortages. We are going to see more individuals retire within the next 2 to 3 years, especially at our campus. And so we're looking for succession planning. We're looking for individuals to bring into the workforce with the different talents and the skills that we need to continue to provide success. I can share with you that our facility has been rated 5-star
Mhm.
by CMS, which is something we're really proud of. Leapfrog rates us an A for the last 4 quarters. And then we were chosen as one of the top 100 hospitals in the United States for hospitals our size. So when you take a look at successes like that, you think back, it's not the brick and mortar, it's the people inside the building. It's those individuals caring for every one of those patients that provides the safety and the quality that you want to deliver to your community. So big challenges are coming up in relation to retirement. We also feel that this year we have seen some individuals leave, mainly because of the ability for them to earn extra money.
Mhm.
And they're going out to agencies. And that happened probably much more frequently about 8, 9 months ago. And they signed on for particular types of contracts. And they said, Margot, we promise we'll be back.
Yeah.
And I said, okay, I just need to get enough money to pay this off or pay that off. And we're coming back. So of the 3 to 4 that left our facility, 2 have come back. The other 2 are still looking for additional contracts to be able to meet their financial needs. Hospitals are being faced with financial challenges because of COVID and the high salaries. So we're all looking at a way to tighten our belts a little bit. But we want to retain the quality staff, those individuals that have the experience and the knowledge and the skill so that we can continue to be successful.
Okay, got it. Thank you for that overview. Okay, let's go deeper in a couple different topics there. So first is let's talk about your hiring strategy, right? So
Okay.
when you think about your nurse hiring strategy and process, what is it that what is it, some of the 2 or 3 most important aspects for your hospital that's made it successful?
I think when we look at our hiring strategies, the first thing that comes to our mind is our talent and acquisition team.
Yep.
That is the name that we give to our HR department. HR does communicate very effectively with us. We have a meeting every week, and my nursing leaders are in on that Zoom call. And because things can happen in a week that you need to get prepared for and ready to be able to develop strategies. So one of the things that we do is first we meet with talent acquisition every week, keeping them updated in relation to what's going on, what's changing, who are potential individuals that are at risk, and individuals that are looking for growth. So that's meeting is very, very effective for us. Second, of course, we advertise and on Indeed and all the other opportunities that exist for HR. And that is great for getting your name out there. But in our rural community, it really hasn't been the most successful. I think for us, utilizing the high school programs,
Yep.
the college programs, and bringing those individuals into our hospital to be able to do their clinical hours has been the most successful. We partner up with Coastal Bend College, Adelmar College, Alice High School, and Freer High School. And the high school programs actually graduate individuals that are CNAs or IB certified and PCTs. But I just met with the instructor from the Freer High School program, and she said, Margot, this year we're working with the local junior college to get them on an LVN track, an RN track, so that these individuals will have an advantage once they graduate from high school. That, in my opinion, has been one of the most successful recruitment events that we have, where I can turn around and share with you. Like, I know I was participating in a high school program, and I had an opportunity to come into the facility and get firsthand experience. And it made such an impression for me that I thought, this is what I want to do, and this is where I want to work. I think it also gives us an opportunity to evaluate every student that comes in. You can tell that student who is hungry for knowledge, that student who is so interested in doing the right thing, connecting with patients, and they are just out there, what else can I do? And to teach me what you're doing and why you're doing it. Those individuals, we jot their names down, we talk to them afterwards, we focus in on those particular individuals because they're the ones we want to target from each one of those classes. We have also had an opportunity to participate with the local colleges to have adjunct RN professors that are full-time staff at our facility. And when they do that, it's also an inroad to those students. And it gives us an opportunity to be able to, again, focus on the quality and each individual that may be a great candidate for us. That's what we consider our long-term workable and successful solutions. Certainly, we did this right after COVID, we found ourselves with a group of agency staff, and then our CHRISTUS group had their own internal agency, but that was a short-term solution. And it's not the best for many, many reasons. So therefore, we turned around and said, what can we do internally to be able to find individuals who will give us a 2 to 3 year commitment? So we reached out to a couple of recruiting agencies, and we recruited some foreign nurses. But again, that's a quick fix for 2 to 3 years. But our long range solutions have been partnering up with the local schools, with the local colleges, and giving them that opportunity to gain clinical expertise at our facility, which gives them what they want and what they're looking for. And it gives us the advantage to determine which one of those students are the ones we really want on our team.
Okay, got it. So I mean, we're gonna go into like break this down to a few different aspects. So first is how was the programs with the schools initially set up between your hospital and the high school? Well, let's take the high schools for example.
Okay.
Yeah.
The high school instructors met with myself
Mhm.
and human resources, and they shared with us their curriculum, and they shared with us the types of skills that the students would be taught during their time at their health occupations program. So we don't normally get students on their first year, we get them on their second year. And the second year students have already been checked off on vital signs, bed baths, all the types of skills that you would expect a CNA to do. Those are the skills that those students have been checked off on. They would come to we of course do all the orientation process, make sure they have all of the required TB or any of the requirements that the facility expects. The students are expected to comply with those. And then after that, they are also given confidentiality statements and an orientation packet. The orientation packet is completed and turned in, and then the instructor meets with us, and we share how many students can we accommodate on each one of our units at a time. They break their student group into two groups. So there's a group of students that come over selected days of the week, possibly 2 days of the week, and they're here for an hour and a half. And then that group leaves and another group comes in for another hour and a half. Now they are given an opportunity to observe first, and then after we are comfortable with that individual student, then they're allowed to assist under the direction of one of our staff members. So, and some of them are at various levels, so some of them observe and they do really well doing that. Others, we've had one that came in and passed out at the door. And then I thought, oh my goodness, when they walked into a patient room, and it was great for them to find out this is not for me. So what an opportunity for high school students to be able to do that and explore those roles. So they stay in their current assignment for 2 weeks, and then after that they're rotated to another unit. If they choose to stay on that particular unit for a longer period of time, they request that of their instructor, and then we make accommodations for them to do that.
Okay, so how many nurses per year how many students can start per year, in your units?
We typically receive about 20.
Okay.
And mainly because they break them up 10 and 10, and we don't want to bombard the unit with so many individual students. So we're very, very careful in collaborating with our directors about the number of students that they can accommodate.
And I can imagine one of the challenges you might have is or the school might have is instructors, right? Like
Right.
So
Right.
how have you solved that problem or that
They
challenge?
have 2 instructors.
Yeah.
And the instructors are required to be on the campus whenever students are there. Now, the instructors are rounding in each one of the units where students are at. They're communicating with the nurses about the skills, the questions. They're available at all times. So the instructors are key for organization, for attendance, for assuring that they're following the processes that we expect. But each one of their instructors, one is an RN and one is an LVN. And so they have the medical background. And at that point, they are the key individuals that are supervising their group while they're in the building.
Got it. And then do you encourage your nursing leaders to teach and to be involved in this as well?
Oh, yes. As a matter of fact, we have sessions. One of our, and we ask the instructors to give us time to give them a 30-minute presentation. An example I can give you is our infection control practitioner. We scheduled time for her to do a 30-minute session, at the beginning of the program. And she goes over things like hand washing, isolation techniques, specific things that why we do what we do. She talks about the difference between a C. diff and an MRSA. So she gives them additional knowledge and relates to them why we do what we do, like why hand washing is so important. Give them statistics and tells them, hey, there's secret shoppers out there that are watching. And we also have a code, so if we find somebody in such a big hurry that they walked out of the room and they didn't wash their hands, they'll tap them on the shoulder and say, hey, Margot, code clean. Code clean means you forgot to wash your hands. So get to the closest dispenser to be able to do that, as quickly as possible. So we have quality and safety have a session for them. Infection control has a session for them. The house supervisor talks about their role and how beds are assigned and how we filter individuals through the ED and what our goals are to get them to a bed as quickly as possible. They have an opportunity to go into the OR and gown and observe. They have an opportunity to work in OB, med surge, pediatrics, the cath lab, the emergency room, ICU. So we offer them, and then we teach them, this is the monitor, what's it for? So we have, our focus is to educate them, to orientate them to what we're doing and why we're doing it.
Okay. Great. And then so if anyone else has additional questions just about the collaboration with the schools, just please feel free to submit in the chat. I
see a question about how do patients feel about having high school students in their care.
Yeah.
Majority of the patients don't mind it at all. And we introduce them, but we also share with them, the student is here, it's as part of their learning.
Mm-hmm.
I have had 1 or 2 patients, and we ask the patient, is it acceptable? Is it okay with you if they stay here while I change your dressing or while I do this or do that? If the patient feels uncomfortable and doesn't want anybody to be in their room, we dismiss the student at that time. But we make the students aware that not everyone is open to students. So we do ask the patient. Majority of them don't mind it at all. But we have had an occasional patient that says, I'd rather not have the student in my room.
Got it. Okay. All right. Let's move on to the other topics related to hiring, and we'll come back to the questions as well. So you mentioned this is one key piece of your hiring strategy. It's
Correct.
essentially you're creating like a pipeline, effectively.
That's right.
What are some of the 2 or 3 other tactics your team is using to hire? I believe you're using fairs, job fairs.
Yeah, we do have. Yeah. We go to the local schools, and our leaders go to the job fair. It's great for our talent and acquisition team to go out there and do that. But the biggest response we have seen is when the nursing leader goes to the job fair.
Yep.
They can talk about their facility and their unit and their expectations much more clearly than HR does, and HR does a great job. Please don't misunderstand that.
Yeah.
But there's nothing like the leader of that group going out to recruit. They often take with them another nurse. And if I've got a nurse that graduated from that program, that's who I want to take. So I take somebody that's a graduate, and then they can share their experience. So those personal, more, those connections that they make with students, I think are the best recruitment tactics we have. Certainly, we tell our staff, because there's such a networking of nurses with each other. And I tell our staff, if you know anyone that you feel would join us, there's a bonus program that we give each one of our nurses. And if they approach an individual, tell them about a position here, and they end up being hired on and there's a category that they must meet, the person must sign on for a full-time position. It must fill one of the high vacancy slots and whatever. They can earn up to, thousands of dollars for recruiting an individual to come and join us. And we do things to and we tell them, come work for us, and let's tell you why you want to work for us. We talk to them about quality and safety. We tell them your opinion counts. It matters to us. As a matter of fact, every quarter we do an associate satisfaction survey.
Okay.
So you're going to have a voice when you come to work for us. We learned that tactic years back in 2017 when we applied for the American Nurses Association Pathway to Excellence program. It taught us a lot about how important it is to include your staff in decision making, how to listen to them, round with them. So these are the kinds of things we share when we go to the recruitment fairs. We certainly have ads, but I think word of mouth and our own staff going to the recruitment fairs themselves, encouraging our staff to look for students that are graduating that would fit our organization, offering them bonuses. Those have been much successful for us.
Okay. And you mentioned that your talent acquisition team a few times already. Of course, the partnership between the nursing leadership and talent acquisition is critical. Can you just describe a little bit more about how those two teams collaborate and partner together to make hiring successful?
Certainly. Our talent acquisition team is a group of individuals that are available for us, and they collaborate with each one of our leaders and with myself. They attend our staffing effectiveness meetings, which is a mandatory meeting that we have to have in the state of Texas to discuss staffing patterns and our plans. So HR is a part of that committee. They're also a part of a committee that meets once a month called Unit-Based Council. And that is when frontline staff come to those meetings and share what's working well, what's not working well. So feedback is given to HR. Now, HR gives us a format that shares what vacancy rates are on each unit, how many individuals have been hired, how many have left, and the reasons that they've left. They share those tools with our leaders, and those tools are what they use to tweak their programs, to make changes, to look for creative and innovative ways to be able to retain staff. So talent acquisition actually has multiple ways in which they help us. And then again, I mentioned earlier in the day that they meet with us once a week because they have to keep a very current a tally of how many individuals we're looking for, what type, and what are the needs that they can assist us with. They also have, because we're part of a system, there's Corpus Christi facilities, there's a facility in Kingsville, Beeville, and Alice. And many a times there's talent at one of our sister facilities that is looking for an opportunity, perhaps in Alice, or perhaps in a position that we have open. So we share staff between each other. And if there's an opportunity for advancement, they can advance and move to that role. So there's many different ways that they keep their finger on the pulse of what's happening. And because they do, they many a times they're that avenue that keeps and helps us retain staff. There's an opportunity for them to also provide one-on-one sessions with each one of the staff members in the event that the staff member needs to talk through something that they feel is an opportunity for improvement. They're the avenue for providing counseling and coaching for some of our staff, because as you are well aware, during the COVID period, this has been a very, very challenging time for mental stability of many of our healthcare workers. So we do offer coaching and counseling and sessions that are confidential for them. We offer debriefing sessions. If the unit's gone through a tough time, there's a crisis intervention team that meets with each one of them to be able to talk them through these particular situations and help them cope in a better way.
Got it. Okay, so you're I wanted to, you're sort of starting to touch on this already. I wanted to just next cover the topic of nurse retention. You know, this is a very top of mind issue for many of those that have joined the call as well. Retaining nurses is a challenge across the country. We're seeing higher turnovers than we've ever had before. And it's a particularly unique challenge in a rural setting as well. So just curious if you could just share just like your overview of your nurse retention strategy at your hospital.
One of the things that I think is the most successful is that the president and myself round very often.
Yep.
Not only do we round, but we round for a purpose. In other words, I get to know who they are. We ask about their day, but we also ask about their family. We try to develop a connection with that associate. We, at that point, ask them, what can we do to make today better for you? Any ideas? Any concerns? So the president and myself both do that, and we do that on day shift, weekends, and nights. I personally come in twice a month at night and spend probably from 9 p.m. till about 2 or 3 in the morning rounding with individuals, and not in a hurried fashion, but sitting back and saying, you know, what's going on your unit, your supplies, are they sufficient for you? Sometimes the challenges and the frustrations for nurses are things aren't working. So come to find out that we could do things like ask plant maintenance to round in every patient care area and in every room to make sure that things are functioning so that nurses don't have to spend the time doing work orders and things like that. So we look for ways to connect. We also celebrate wins. Every day at 9 o'clock in the morning, we have a safety huddle, and all leaders are on the safety huddle. And during that time, we ask them, in the last 24 hours, is there anybody I need to send kudos to? We have a kudos program, and the program allows you to send 250, 500 points, and 1,000 points to individuals that have gone above and beyond to help you, to support staffing, to come up with ideas. they can redeem those kudos points for gift cards, electronics, clothing, luggage, and the program is called Kudos Program. And and if you just want to reach out and say, I want to give kudos to Sally because she was so kind to that patient and she really did a good job connecting. When you send the kudos recognition, you can also make their leader aware, and the leader can boost the points and add more points to it. I think one of the greatest things that we've done is done the kudos program. Whenever anyone's having an anniversary, everybody is aware. When you're having a birthday, people are aware, and you get to put your little birthday wishes on there, your kudos. So that personal connection is one of the most successful retention strategies we feel that works for us.
Great.
And of course, the second one is the ability to listen to their opinion. The leaders use a picture of a stoplight, you know, those long old-fashioned stoplights that have the red, green, and yellow. And they put that on each one of their units every month. And staff has an opportunity to write in there what things they want addressed. And then the leader looks at it and says, okay, I listened to this one. It's in the green now because I fixed it. So we're good to go. If they needed more time, they put that individual request in the yellow light, and the yellow light says, I've been able to do this much, but I'm not finished yet. And the red is, I acknowledge your concern, and at this time, I cannot do anything about that.
Okay.
So it gives them a chance to see, hey, what are people asking for, and what's the leader doing about it? And this way they can provide a more a better way to communicate without actually having to be there every day, every evening, and every night when these things come up. But it's their other way of communicating.
Okay, so you've to summarize, you've developed communication and feedback loops with the team.
Correct.
You've the leaders are rounding, so there's trust and communication that's being built all the way to the senior levels. I'd love to just talk about the CHRISTUS mobility program, as well as the ability for your team, for your nurses to transfer among facilities,
Right.
and the role that's played in retention too.
The transfer program is one that allows any of our associate to transfer to any CHRISTUS facility that exists. Our Facebook page and our CHRISTUS page, our homepage, certainly has opportunities for people to take a look at all positions that are open. So if you have been at your facility and have successfully completed 6 months at the current role, after 6 months, you can transfer to another role and another facility. The process that you submit is a request for transfer through HR, and HR will then submit that to the receiving manager and to the transferring manager, making that person aware that their individual wants to transfer out. Sometimes they don't want to lose them, and they turn around and say, what can I do to keep you? Other times they're saying, I know why you want to go. It's an opportunity for you. I'll support you every step of the way. So at that point, they submit the transfer. The receiving facility interviews the individual. And if the person is accepted and the interview is successful, then they agree upon a transfer date. And they'll transfer over to that other facility, not losing any benefits, any seniority. So it's a great opportunity for growth.
Okay. Fantastic. And then last topic I wanted to ask you about is just about flexible scheduling. So we talked about
Oh,
we talked about the nursing, pipelining from the schools. We've covered your job fairs. We've covered several aspects of your retention strategy. But just, the second most common reason why nurses are changing jobs is they're looking for a better schedule. So curious
right.
is how you think about scheduling at your facility.
Well, the biggest challenge for us is young mothers. Young mothers look for opportunities where they don't have to be away from their family. So majority of them, and our shifts start 7A to 7P and 7P to 7A. And I tell them, I'm jealous of you because you're working full time, but you're working half the month. And that's the way it works out, because we end up giving a full-time associate an opportunity to do 3-4 or 3-3. So they can do 3 days a week or 4 days a week. The week they do the 4th day, they automatically go into overtime. But I approached at the unit-based council, which is a council made up of one individual from each of the units. And I asked them, would you like to go back to 8 hours? Let's do 7 to 3, 3 to 11, 11 to 7, or let's do 8 to 8 and 8 to 8. The overwhelming response from our staff
Yep.
was no,
Okay. That's
no, don't do it. So I have flexible hours in the emergency room. And why? Because my evenings in emergency room are the busiest. So that staff said, please give us 11 to 11. And that, according to our heat map, demonstrated that that was the busiest time and where staff needed the most support. We do ask some of our CNAs or PCTs to do 4-hour shifts, and they like that. We give them opportunities whenever we're going to have a situation where census flexes down. We ask them who's the first that wants to be cut, who's the second, or flexed off. And sometimes they've got family situations and all, and they do. I can tell you, the leaders work really, really hard to give them the days off that they need to meet their family issues.
Yep.
We just, and I actually had a team of nurses that came forth and said, Margot, I've got somebody on nights who's on my rotation that wants to do 8 to 8 instead of 7 to 7. I said, go for it. Do
Okay.
it. Just do it.
All right.
And they did. And so it gave that nurse an opportunity to drop her kids off at school. And then it gave the other nurse who didn't have school children the opportunity to get off at a time where she said, I can run to the store, or I can go take care of business that opens at 8 o'clock in the morning before I go home and go to sleep. So we're very, very flexible with our hours. And so I've offered 10 hours, 10
Yeah.
hours, 8 hours, 4 hours, 6 hours. They feel that the 12-hour rotation, at least the individuals in Alice, it either gives them that opportunity to spend more time at home, or they pick up a part-time job. And when they pick up the part-time job, they know in advance when they're going to be off, and they can work 6, 8, 10 hours with that individual. And that brings them the extra money that they need and provides them with the flexibility. And I had a house supervisor that I loved to death, but just great. And she said, Margot, my kids are 3 and 4. I really need to be at home with them. and she was doing 7A to 7P, and her husband was a coach.
Yeah.
So anyway,
Okay.
she ended up having to have more different hours, but that worked out for us too.
All right, so range of scheduling options, but sounds like most of them want to stick to the 12-hour shifts.
That's true.
Okay.
That's been my experience.
Okay. All right. We work with 600 hospitals across the country, and it varies, right? We have some nursing leaders that need to offer a whole range of, like, a whole menu of options, including part-time roles and weekend shifts and so on, in order to improve retention, and also helps with hiring too.
That's true.
All right. So what I'd love to do next is just spend 3 minutes just giving a quick overview of Incredible Health, and then we'll spend the rest of the time on Q&A so we can end on time.
Okay.
So Incredible Health is a software company. We're based in San Francisco. Hospitals use our custom matching technology to hire high quality permanent nurses in less than 20 days. We are used by over 600 hospitals and health systems across the country, including very large health systems like HCA and Tenet. We work with many academic medical centers as well, like Stanford and Cedars-Sinai and Johns Hopkins. We work with many community hospitals as well. I actually happen to be based in Texas as well, and we have a huge presence in Texas. We work with Baylor Scott and White and Memorial Hermann and many, HCA, Tenet, many of the facilities in Texas as well. So there's 3 unique things about us. First, the employers apply to the talent instead of the other way around. As you can imagine, the nurses absolutely love that. They create a profile, they sit back and relax. They hear from different employers, and the nurse gets to decide which interviews to accept or decline. We've also automated the screening of the talent. So we are checking things like licenses, certifications, malpractice records, so on. So we're serving up high quality talent to the employers. We also have built matching algorithms, so which makes it a much more personalized or curated experience for both sides. So let's say one of Margot's wonderful talent acquisition team members is using the platform, and they log in. Like, they don't really want to see 276 nurses. They need to see, the 10 or 15 that are the right fit for CHRISTUS at that time. And then finally, we provide a whole set of data analytics. It helps leaders like Margot, nursing leaders, and as well as talent acquisition leaders, identify bottlenecks, how their hiring processes can improve, and it's anonymized with a lot of competitor data as well, so you can compare yourself with your local and your national competition too. All right, so nurses join Incredible Health for a range of reasons. We have over 600,000 nurses on the platform, so we're just over 10% of the U.S. nursing workforce. We offer a whole range of free tools and services to nurses in our apps. Free continuing education for every single nurse in the country, which is accredited in all 50 states. They can use our salary estimators. We have nurses have access to talent advocates or career coaches. We even have a community of nurses in our apps where they can ask each other questions. It's like a Quora for nurses, where they can get advice from each other. And so this is ultimately what attracts the nurses to the platform, and then some of them are also using our hiring marketplace too. Did want to just share that just the importance of hiring operations and speed. The data from our platform shows that 68% of nurses accept the very first offer they receive, and 61% accept the very first offer they receive, even if the second or third offer has higher compensation. We notice this in every market where we operate, where the employer that is operating, they're hiring in the most efficiently and the most quickly is actually hiring the most, not necessarily the employer that's paying the most or the employer with the biggest brand. So hiring operational excellence is really critical to success in driving permanent nurse hiring. This is just a quick case study. This is actually a team in the LA area. And so for this team, we were really able to reduce their speed from 66 days to hire to 19 days. And these are the different steps of the hiring process. Where we have the biggest impact is on time to source, where we're really able to get that down for this team from 44 days down to 3 days. And then that, as a result, offsets a whole at least $2 million in temporary labor costs too, because you're able to hire permanent nurses faster. We also monitor retention on our platform. And so we have a 50% higher retention rate when nurses are hired through Incredible Health compared to hiring from other sources. And I'm referring to the 1-year retention number. All right. This is a collaboration. So we work collaboratively with an existing in-house talent acquisition team. So Margot mentioned earlier how awesome her talent acquisition team is. The purpose of the Incredible Health technology is to support that existing team. We are doing a lot of the heavy lifting in the first 4 steps of the hiring process, finding the talent, making sure they're actively looking, getting them automatically scheduled for their first phone screen. And then that in-house talent acquisition team is taking over, completing phone screens, getting hiring manager interviews completed, and getting offers out. So this is a true collaboration. It's a true partnership. And it's a new model in talent acquisition too, because recruiters need to operate at the top of their license as well and the top of their skill set. All right, so let's do some Q&A. Quite a few questions were submitted, which is awesome. A question from Dante for you, Margot, is have you considered sort of forming like a joint venture nursing program at your hospital, or like in collaboration with that school, with the schools, like formalizing it into like an actual joint venture?
Not really. That's a great idea. And I think that my concern initially was that it might limit the number of individuals that I maybe have access to. On the other hand, it might not. But we do have 2 different schools that we can recruit from. Mm-hmm. So we have the one in Coastal Bend College and Del Mar in Corpus. So there's one in Corpus Christi, and as a matter of fact, 2 in Corpus Christi, and then there's one that is has a satellite campus here in Alice. I think that I've never approached them with that. I don't know that I know how to structure that. If somebody's done that in the past, as long as it doesn't limit the ability to work with anyone else, that's probably a great idea that I haven't thought about.
Awesome. This isn't a question, it's more of a comment. So Sandra Vincent mentioned, thank you, Margot, for the great strategies. I'm in Gulfport, Mississippi, and we had a similar program and it was very successful. So thank you for all the reminders. Question also from Sandra is about your kudos program, that appreciation program that you have, that helps with retention. Is it something internal that was created internally, or are you working with a vendor or company that yeah?
We're working with a vendor.
Okay.
And we actually had to budget for it in our facility. And our thoughts were, I'll bet we could create something a little more personal if you didn't want to do that. But yeah, we go through corporate office and we have a corporate contract with it.
Okay. Another question. I think we have time for 2 more questions. By the way, I know we won't have time to get through everybody's. You're more than welcome to also email us at questions@incrediblehealth.com, and we'll get them answered for you as well. The reminder that the recording, this is recorded, and our member of our team will also be sharing this recording with you as well. Okay, another question that came for you, Margot, about the students and when they're on the units. How do you handle risk management and liability?
The students orientation program has been very specific. We do share in the event that the student is injured while say that they have a needle stick. They are treated like a patient. They go to the emergency room, and their personal insurance or their family's insurance is utilized. So we have nothing to do with insuring them. We don't treat them like associates. We have that understanding in the paperwork that the school fills out with the student and the parent or guardian in advance. So if there's anything that needs to be taken care of, or anything that happens to them while they're in the building, they get treated like an emergency room patient.
For those of you that are interested in hearing more about Incredible Health, my colleague Danny also shared in the chat a link to sign up for a demo as well. All right, well, Margot, this has been really phenomenal. Thank you so much for sharing your strategies and tactics. I know that rural facilities have a different set of challenges compared to urban areas when it comes to hiring and retention, and what you shared overall, but in particular the work with the schools is pretty phenomenal. We don't see this often, so really appreciate your time today, and thank you everybody for joining. And
Thank you.
And we will be in touch with all the attendees as well with the recording.
Thank you. Have a great day.
You too. Thanks, Margot.